Hi all, welcome parents to episode 2 of Pearls of Wisdom. This is one more step towards creating awareness among parents. The Facebook parenting group is basically a support group wherein we can all help each other. So there is a resource pool. We are building a resource pool in the Facebook group. So episode 1, we spoke to Mrs. Vrinda Valimbe on couple time. Today, we'll be having a conversation with Ms. Tanha Gowande. She is a practicing psychologist in Mumbai, and she would answer some of the queries which normally parents do have. What do we do? Why is this happening? So just a very, very friendly conversation, I would say. We are not going any depth or anything, just for us to understand for everyday parenting. Okay, do I take help? Do I not? Can I ignore this? What should I do as a parent? So these questions are based on that. All these questions which I'm asking her is on your behalf, because so many parents come with so many queries to me. As a mindfulness coach, I give you one perspective. Now you're going to get one more perspective from a psychologist. Okay, so welcome Tanha to this session, and thanks for accepting my offer and talking to our parents.
Thanks a lot. I'm really glad to be a part of this initiative, and I'm looking forward to it.
Yeah. Okay, I'll pop up with the first most asked question. Okay. So we all know that we are going through drastic change in the social environment. Okay. Whether be it social media, technology, how schools are conducting classes, the educational institutions also, there is a lot of change. We have so many boards, so many curriculums, so many kind of varieties of approaches. Okay, so simple thing like technology is something which we cannot say, no, my child will not have screen time, because that is a new thing. It's going to stay with us. Okay, so there is a change in the environment. So children are growing up in a different way in comparison to our childhood. So flashback of our own childhood, what our parents did may not work now, because things are very, very different. So tantrums and misbehavior are common challenges faced by many parents, okay, especially post-COVID, because there is an adjustment problem also, because there is a shift. Kids have been inside the house for 2 years. So there is tantrum and misbehavior. I get lots of queries. Refusal to go to school, or refusing to study. There is that defiance is coming up. Like kids are getting very stubborn. So the question is, how can a parent understand the red flag? That is, when should they know? How do they know? Okay, this is something which the child will outgrow. I can let it pass. Or I have to do something as a parent, normal parenting strategies. Or is it time that I take a professional help? Should I just take a second opinion rather than sitting on with the problem? Clearly, tantrums and misbehavior.
Okay. So basically, from my perspective, as far as what I have seen in the parents and with kids, is that you need to observe the frequency of behaviors. Like how many times the child is showing that behavior. If once the child is showing it, that's okay. If twice, that is also okay. But every time, like for a month long period or for 2 months, there is same behavior repeatedly happening and in all settings, be it in school, be it in home, be it in like social functions, the child is throwing tantrums, then it's a red flag. Because many people, like I've seen my parents coming and telling me that my child is hyper. Whereas what we see is the child is active. He's not hyper as such because they are trying to explore, they are trying to come up with new games and everything. So the usage of words also play a lot of role. Like many parents just see it as a red flag and then they start panicking. But rather, you just observe the frequency of session. For example, screen time. Like if the child is engaging into meaningful play or educational content, but on a bigger screen rather than mobiles and everything on a bigger screen, then it's not a misbehavior or anything. But if the tantrums start after that and it is repeated for a month, like for every time when the child wants to see screen, there is a tantrum, then it's a red flag. Otherwise, it's a normal behavior. So the concept of red flag has to be understood based on the frequency and how many times it is reflected in different scenarios. Like if there's a change of environment, same thing, same behavior is happening, or the child is showing same behavior in school also. Whenever they want to watch screen time or whenever they want something. Also, it also depends on what the child wants. Like most of the times, parents are not attentive towards what the child wants, hence the behavior starts. So it is also a trigger point for them as to my parent is not attentive, hence I will start throwing tantrums. If you are attentive, if they are listening, and kids understand whether my parent is listening to me or no, they
Okay.
have that kind of sense. So red flags are seen in different formats, but what we see is the frequency of behavior. If
Oh,
it is happening for some period, it's okay. Do not make an issue of it. That's it.
all right. Okay. So very valid point. So the takeaway is you just need to, as parents, we should observe and understand the frequency.
Frequency.
Okay. Whether the same misbehavior is happening for a longer duration
Don't agree.
and in all environments, social, school, and home. In all the three areas, if it is happening, yes, then it is a red.
Then it's a red.
Thanks for that. So moving on again, it is all in the same line. So sometimes children don't follow group norms. For
Hmm.
example, going out of the classroom without asking the teacher's permission, or just roaming around in the school,
Hmm.
not following the school norms at all. Or there are sometimes there is a complaint like, they throw things, whether at home or in the classroom, throwing the, maybe the chair which they are sitting, they just throw it. So these kind of behaviors are also, we get to see these also at home and in classrooms. How should a parent or teacher deal with this?
Okay.
Not sticking to group norms.
Okay. So now, as a behavior therapist working with kids for more than 4 5 years, what I have seen is that there are four functions of kids' behavior. So the four functions are attention seeking, avoiding certain things, escapism. Then there is they need something, so access to tangibles. That is the term that we use. That they want certain activities or items, hence they do that behavior. And the fourth one is sensory stimulation pertaining to kids having autism, ADHD, neurological conditions. So if you just observe any of these four behaviors, for that there has to be observation again. Like instead of directly concluding that child is showing tantrum, if that behavior is seen for a longer duration, so once you go into that observer mode, you start observing these kind of behaviors, whether this behavior is for attention seeking or this behavior is for avoidance. So specifically, like when kids want to go, like they just run out of the classroom, it at times it is more of a sensory overload for them that they are very much stimulated by the noise, the lights, and everything. So that is the reason they run away from the classroom, or at times they just want to escape whatever is going on in the classroom environment. So it can be any specific topic, like specific kids are very much sensitive to math. Like if the teacher starts talking about numbers, they feel anxious and they want to escape that thing altogether.
Okay.
Hence, they start showing that behavior. At times, when teacher is not looking at them, or the other teacher is not attending to them, whereas they are attending to the other kids, then they will do something which is again an attention-seeking behavior. So it can fall into any of these four functions of behavior, and that is how we identify what is the exact function of that behavior, and then we start intervening. But again, for that, observation is required, like at least 1 to 2 weeks observation, and then going ahead to whether this behavior is again seen every time when there is some topic which has come up and the child is showing that behavior or any kind of tantrum. Generally, running away behavior is for avoidance purpose only.
All right.
They want to avoid that stimulation.
So we now,
If
okay, the four areas are very key points, like, either it is attention seeking or avoidance. Correct. They want to avoid something. And the third point, which you said was
third one is
access to tangibles. Access to tangibles. They need something different. Like, if they have something in their mind, they want it. So access to tangibles or else sensory overload. Okay. Now you observe it, but in the classroom or at home, parents want answers. Okay. What do we do
hmm.
at that
So
particular?
your So once you like in the as per the behavior modification strategies, what one can do is ki instead of directly giving it to the child, first just ask them ki first you tell me or first we will do this, then you will get access to it. So anything has to be first and then usage of these terms. So accordingly, the
Oh,
child also
okay.
understands I don't have immediate access or I will not get what I want immediately, but I have to wait for it, do something, do some activity, and then I'll get it. So in a way, the child gets the attention that they require. The child's whatever thing they want, it is fulfilled. But they also understand the concept of waiting. Most of the behavior, most of the tantrums come out because they don't have waiting period or that waiting tolerance for that matter.
Understood. Okay.
So that can also trigger a lot of behaviors. If they don't know patience, they don't know how to wait. Hence,
Correct. Okay.
they start showing those kind of behaviors. So just first and then, instead of bribing, कि पहले you do this and then I will. Instead of that, first you do this, you are going to get it. So giving them reassurance also at the same time. So first and then is the concept which can be easily applied by all the parents.
Right.
First do this, then
Even going out of the classroom and all, teachers can confidently say, first you do
correct.
this work, then you can go
First,
out and do it.
correct.
Right?
Plus using we more rather than you.
Hmm.
Because then they feel that I am the only one who's being targeted, whereas if we use we as a term, कि first we will do this, then we are
Yeah,
going to
fine.
go outside.
Okay. Yeah.
That makes a lot of difference.
So, as a one-liner answer for that question, for not following group norms, we should first, observation is one part. Okay, that is the. But what do we do? The action part comes like, use the phrase first and then, using the word we. First, we will, whatever the child has to do at that time. Then, whatever
We are going to
behavior the child did, like going out or whatever, then it can do that. So by this way, we are basically targeting all the issues, right? Whether attention also the child is getting, if it is avoidance also, it learns to accept rather than avoid. Correct? Okay.
right.
Thanks. Very, very valid point, because lots of parents ask this question. Okay, what do we do then? Okay, now this is happening. So first and then is a good takeaway. I hope all parents can, even remember this or take a note on it. First and then, first we and then. Use that phrase for group norms and any kind of misbehavior, immediate action, where immediate action is required. And now Google search, okay, is giving lots of statistics and information for all big and small things. So now we are in a phase where everybody knows everything.
Right.
Okay. Simple, like, no eye contact. Okay, immediately it pops up. Is it autism? All right. My child is like, not is running around. Is my child hyperactive? Because there is an information overload. Like, you read, you hear, and all these self-help and all these kind of strategies. Okay. But in a very practical manner, what are the developmental milestones which a
Hmm.
parent should, so that they don't get overwhelmed when something happens? Okay.
Hmm.
So just to, like, one of the parent did ask me, like, this question, like, okay, never, no eye contact at all.
Hmm.
I said, first thing is there is a change in the environment now. Like, they are used to screen time more. Okay,
Hmm.
so they live more in the virtual world. So if your child has excessive screen time, or if it is playing around with its own toys, it's not having social contact, the child doesn't
Right.
even know to do the eye contact. So not necessarily the child is autistic. It could be.
Hmm.
I'm not saying like, no, 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 ignore it. But when you look at it in an overall manner.
Hmm. Hmm.
So I'm just giving this example because this is the kind of query, because they're scared. They don't want to go to a psychologist also. They don't want, but they keep on reading on internet, which kind of
Correct.
aggravates the problem.
Hmm. Hmm.
Because Google search, based on the question you put, you get answers,
Exactly. Right.
right? So what are the developmental milestones, like, which a parent should know? Like, whether it is the social behavior, it includes all
Hmm.
the questions I asked, the previous questions also, group norms.
Hmm. Hmm.
So what the
Okay.
child can do.
So the basic developmental milestone that we assess are first of all socialization skills, like whether the child is even responding to name calling. Like if you just call their name, whether the child comes to you, looks at you. So that is one thing. Whether the child listens, follows instructions. So instruction following, whether it is repeated instructions. So these are small developmental milestones which eventually occurs, but if doesn't happen, there can be a lot of causes. So the third option is toileting. So whether the child has started indicating, or have you trained the child to indicate when they want to go for toilet, or when they are, nearing to that stage. So toileting is one of the developmental milestone. Dressing on their own, or looking in the mirror and grooming themselves, or using different items, like girls, they are fascinated by makeup products, so do they try on different things? Are they curious to know? Are they curious to look at their mothers and follow the same thing? Imitation is skill is something which is a developmental milestone, whether the child imitates the way you walk, the way you speak. So
Mm.
that is one of the milestone. And most of the time, what I've seen is parents project their feelings onto the child. He's behaving like me. Whereas every kid is different, every developmental milestone comes at different stages. These are the basic ones. The socialization is there, communication is there, self-help eating, like whether you are training the child to eat with their own hands, chew, or sharing while eating. So whether that is happening. So these are some of the things which are seen as a developmental milestone, but at times, what I see is that the parents have not trained the kid or exposed them. Like if the child is taken to a market, so that taking him or her to a market is a milestone for them. Ki how they behave in that kind of a social setup. If you take them to malls, how they behave there. So first, the parents need to expose them to many different things.
Right.
Directly, they will not start developing on their own. You need to expose them to those kind of environments. Try out different things. Like, for example, brushing is one of the milestone. So whether you are giving the child a brush, imitating with them, doing it with them, and other steps to be done, and following it on day-to-day basis. Not just ki once I have told the child and then the child
Mm.
will learn on its own. It has to be repeated behavior from the parent side. So most of the time, the lack in developmental milestone is because the child is not exposed to those kind of environments, or not given those training. Basic, like at home, if you tell the child, "Ki, bring this to me, bring that to me," whether that child is following that or not. So that comes in instruction following, that comes in attention skill development. So it is a combination of many skills, but basic. Like if you give child some kind of food grains and just ask them to sort out whether the child is taking interest in playing in kitchen, so playing with those items, or exploring different areas of the house for that matter, or whether the child is just sticking to one area specifically. So these are the developmental milestones which go, and till the age of 5 years, we don't really come to any kind of conclusion for that matter
All
if
right.
there is no developmental delay. So
Okay.
till 5 years is an exploring stage where the child will show behavior as per their preferences. It is nothing which is like generalized in general. This is like at the age of 2, the child has to speak. It is nothing of that sort. So till
Understood.
5 years, it is still an exploring phase. After 5 years, if the child is not doing like eye contact, not following instructions, not able to indicate toilet, not able to bathe, or at least try self-help cleaning, not maintaining hygiene, not able to eat, then there's a developmental milestone. Till 5 years, it is still an exploring stage. So 5 years and above, parents have to take a lot of initiative as to exposing the child to different things, training the child, experimenting
Mm.
with them, experimenting with new clothes is also a developmental milestone. Like whether the child is accepting new clothing, or the child prefers only one type of clothing. So that is also a milestone. So
Understood.
basic general domains, if we go to see, it is more of self-help eating, dressing, toileting, transferring objects, like instruction following. Whether a child is able to transfer one object from your, bring something to you. So these are some socializing with other people. Like if any family members come at your place, if any comes to your house, the child is able to identify them, look at them in their eye, how are they around them. When the relatives come second or third time, are they able to go to them and then
Mm.
socialize with
Understood.
them?
Yeah. Okay.
So these are some of the milestones that we look for.
So generally, if these things are in place, the parents really need not worry about one factor, like no eye contact, or
Exactly.
getting complaints from school that the child is hyperactive, as you first said, running around is also at times termed as hyperactive, or ADHD. ADHD gets labeled very quickly.
Very good. Yes.
So around till the age of 7, if for the general milestones which you described now, if that is happening, there is no the parents can be very confident, no, the growth, there is no developmental issue as such. The child is, all the
Age
behaviors
of
are
5.
normal till the
Till the
age
age
of
of
5.
5 years.
So otherwise, because behavioral is something, behavior and misbehavior is basically, we just need to do the correction procedures.
Correct. Correct.
Correct. So
Plus, one more thing I would like to highlight first, what I have seen till now is that when parents report certain things to a doctor, the doctor has very limited amount of time for taking information. So, if a parent report directly, my child is not giving eye contact at the age of 2 years, then because doctor's judgment has to be quick, they will associate it with autism or with ADHD. But we see, like from psychological point of view, what we see is ki the way parents report it or the way parents see it also makes a lot
also
of difference.
matters. Yeah. Okay.
We do not see those kind of things, whereas parents are just reporting he's hyper, so it is termed as ADHD. So that also makes a lot of, but till 5 years, if, in general, if the parents are aware, you have to expose them to different situations, like beach, taking the child to beach, taking the child to market, malls, and just observing the behavior which are shown at house. So behavior has to be consistent in all the areas.
So this exposure would also help to train the child, right? So when we talk
Yes,
about misbehavior, we need to expose them to proper behavior also. So we need to, the past parents, if they
correct.
give the exposure, that would also help.
Yes,
Okay.
yes.
So, and another, again, a common query is bedwetting. Okay. Is bedwetting a serious concern? Or does a child, like every child has its own age to outgrow it?
Hmm.
Is there a
Okay.
specific
So,
age, or do kids do it? There is a delayed uh,
hmm.
process also for some children, they outgrow it only after 7 or 8 years or something like that.
Okay.
Bedwetting, yeah.
As per our like assessment, if we see from our perspective, bedwetting actually has many layers. Till the age of 5 to 6 years, it is acceptable behavior, but after that, it can fall under anxiety disorders. Like if a child has faced any kind of traumatic situations, bedwetting can be a result of that trauma which is replaying in their head. Or at times when the child is unable to express, it comes out through bedwetting. So it has actually many layers. Generally, we see it as anxiety disorders because bedwetting is one of the causes of anxiety disorders. The child is anxious than normal, and
Okay.
at times it can be side effects of certain medications as well. Like if a child is on heavy antibiotics, bedwetting is a side effect.
All
So
right.
again, consistency, frequency is a matter here. For how many days the bedwetting is happening, or is there any trigger point, like whether the child is facing any bullying in school, and then there is bedwetting which is seen. So again, it's a trauma response, it's an anxiety response. The child is not able to express. So
Understood.
actually, it has many layers, but a significant history has to be there. History of any kind of trauma, any childhood abuse, for that matter, any situation where they were fearful, excessive fear is seen in the child. So any situation that triggered that fear response. Hence, bedwetting can be. Otherwise, it generally fades on its own. If the child is trained, so your even parent intervention, the child has to be trained to go to washroom before going to bed. Or if the child has excess need for drinking, at times, like I had some patients where the child had excess need to drink water to avoid some particular food which the mother was giving.
Okay.
Hence, he used to just drink lots and lots of water, and then it resulted in bedwetting issue.
All
So
right.
alteration has to be there from mother, like parents' side also.
So
Some
can we
intervention, like
summarize,
training the child.
after the age of 6, if bedwetting is there, it is a good, maybe a professional opinion would help parents. Correct? After the age of 6.
Correct. Yes.
Till the age
Yes.
of 6, they can, they need not
Yes.
worry that much. After the age of 6, just we can always, it is better to talk to a professional just to understand whether the child will outgrow it or any remedial action has to be taken.
Correct. Also, from the age of 3 years or 4 years, if the child is trained to go to washroom before going to sleep, specifically before going to sleep, then eventually the bedwetting fades away because the child is not trained only to go use a washroom. Hence, they think this is the appropriate way. So,
Understood.
training here is much more important. Even if after training things are not falling in place, then a professional advice is needed.
All right. Okay, fine. And in India, there is still a hesitancy even with the word psychologist. Okay, there is a fear. The hesitancy probably could be the fear of unknown or the fear of being judged or whatever. We don't know, but there is a kind of, it's getting better now. People are more open to it, but still there is a hesitancy. Okay. So can you throw some light on how a psychologist can help with that?
Okay. Generally, we as psychologists do conduct workshops and seminars on different topics. So, if the parents can attend those workshops, also, I would like to point this out that I have seen this mindset in parents that when a child has an issue, only then they are consulting a psychologist or a mental health professional. But if they do it as a for weekly follow up or monthly follow up, just the way they do it with pediatrician or their regular
Hmm.
doctors. So having that holistic mindset is something which can bring lot of difference. Not only going to a psychologist when there's a specific issue, but just a regular follow-up just to evaluate their overall development from academic point of view, from intellectual point of view. Because the pediatrician has told them to visit a psychologist, there is some issue, hence they go. So instead of keeping it that as a barrier, they can just go and take a session with a psychologist just to understand their own child.
All right. So
Plus,
every
attend
parent can
workshop.
talk to a psychologist, basically. It would just give them more points,
More
like more
insight into
understanding
their
about it. Okay,
yes. So
fine. So
not
that
just
means
relying on
psychologist can
not
give a normal session or a workshop also. Like, you help them that way also. You
definitely.
general
Yes,
topics.
yes.
Okay.
More of spreading awareness, giving insight into behaviors.
Okay. And now I just come to one more area because the main reason why I'm including the next four questions is lots of schools are going with inclusive approach. Okay.
Hmm.
So for both the children, the special needs children and the normal children, they are going to be together. So
Hmm.
it's like, that is a new thing which is going to come. So in preparation for that,
Correct.
I'm just taking the next four questions. Okay.
Hmm.
So
Okay.
children with special needs, we call them gifted children. So
Hmm.
how are they different from a cognitive or physiological perspective?
Okay. So the main difference when it comes to cognitive aspects, it's more of the logical reasoning abilities, the memory abilities, understanding abstract concepts, or taking judgment for that matter. So these are the four more main domains which play a lot of role when we differentiate special needs and normal children. Because as if there is a cognitive deficit, if the child has developmental delays, then the brain development is hampered and these areas get hampered. Like logical reasoning is something which there's a lot of difference there. Memory capabilities. The child is not able to remember a lot of things. So that becomes a hindrance in academic development, in overall growth. The child is not able to take social judgment. Like
Hmm.
if the child is walking on a road or what should be done in emergency situations? What should be done when you're faced with sudden fear or sudden kind of crisis situation? So overall awareness about that is hampered when it comes to special needs, specifically with cognitive deficits like intellectually disabled people. Plus, like from physiological perspective, if we go to see like CP, like cerebral palsy children, so their overall development is hindered because of their disorder. So physical development, like motor movements or walking, crawling, that is definitely hampered, which creates impairment in overall function. So there there the difference is seen. So that is where plus many kids like special needs have need-based communication, whereas normal kids have normal communication, socialization. So again, communication is one of the area which gets hampered if not trained at a regular interval.
All right.
So
Okay.
these like logical reasoning and these areas will be hampered even if there is a training given to them because there are levels to the training which they can receive.
So can we summarize, like, in a class, supposing in an inclusive classroom, okay, the major difference will be on basically how we communicate to the child, because their memory and judgment and social response will be slightly different. They have
Yes.
a different way of
The
dealing with
reasoning, like why they won't understand the why behind
why behind it. Okay. All right.
what's
So do they realize that they're different?
uh, as per my experience, what I've seen is kids who have average IQ, like for example, if the kid has autism, but his IQ is average, which falls between 85 to 100, then they understand that they are different because people don't come and talk to them the way they should, or they feel isolated. They have issues making friends. So it depends on the intellectual quotient first, that the awareness that I am different, or
Okay.
even kids who have learning disability, because they see other kids writing or reading in a certain manner, whereas I don't know how to do that. So that feeling can sink in, but for that, intellectual quotient has to be falling in the average range.
All right. Okay.
Difference, like then the kids can understand that they are, different.
So how will a parent know, like, how do we normally assess or confirm that a child has different need and requires a different support system? Mm, I was asking you the question, like, how do we assess or confirm that a child has different needs and requires a different support system?
Okay. So, when it comes to intellectual disability for that matter, the first thing that we ask is there a developmental delay in the milestone? So, if the child has delayed developmental milestone, then we assess them based on the different development age stages, whether the child is able to do. As per the diagnostic criteria, again, there is a criteria that this behavior, whatever the issues are, it is seen consistently for 6 months and above. It has not started just 1 month prior or 10 days prior. So there has to be a 6 months criterion which is required. Also, it is seen in all the settings, like again, home, social,
School
and
and social. Okay.
if those criteria are met, plus the criteria that we have, like for example, if the child has autism, so autism may our questionnaire is of 40 questions. So if the child qualifies for all those questions, then they have autism. For even for that matter, when it comes to ADHD, the child again is seen into two domains, that is inattention, hyperactivity, and impulsivity. Again, there are a lot of sub
Correct.
criteria as to whether the child shows all this in all the settings, and the frequency of the behavior is more than 6 months. That behavior is seen more than 6 months. Then it is given a diagnosis of ADHD and accordingly, like disorder levels. So there are a lot of criteria. Only if the child is showing behavior which is just 10 days prior, 1 month prior, then we rule out. Plus, if the child has any kind of physical disability like hearing difficulty or vision difficulty, if that is the case, then they don't get a diagnosis of other psychological disorders. They have to first rule out any physical disability which is
Mhm.
seen, physical impairment which is seen. So after ruling those things, then we go for assessment, a proper diagnostic assessment.
So if things are going good in all the other areas and only the behavior is an issue, parents need not actually worry about any other major issues. It is
No,
just that behavior needs to be correct. Correct. They
correct,
need to
yes.
correct the behaviors.
It's not related to any development
Correct.
functioning or any impairment as such. It is more of a behavior. So just having an understanding of what are the behavior functions that would help the parents more.
Yeah. That, as we discussed before, either with the psychology, attending
Correct.
workshops, or getting more knowledge rather than only reading and understanding about it would help them. Talking to the right people and or attending workshops. And one more question, like on the learning disability, because that again comes in an inclusive school. Okay.
Mm-hmm.
What is learning disability? Now, we all know, most of us know, thanks to Tare Zameen Par, only dyslexia is what, that is the only thing that crops up when we talk about learning disability. So, two things: learning disability, what it is, and whether that can be corrected. If
Okay.
yes, how much? How much can you expect the child to get better? Okay, if it is having a learning disability.
Okay. So, learning disability is basically a neurological condition wherein the child specifically shows issues in reading, writing, and math abilities. So, it is termed as dyslexia, dysgraphia, which is a writing disability, and dyscalculia, which is a specific issues only when it comes to mathematics. So, there
Mm-hmm.
are three criteria: dyslexia, dysgraphia, and dyscalculia. Plus, there is difference in the way they process information. Plus, one of the major factors in learning disability is that the child may show forgetfulness or the child may have difficulty responding with copywriting. The child shows issues with spelling, with there are a lot of spelling mistakes, handwriting is poor. So these are some of the key, what you can say, traits which are come up. And it only comes up like learning disabilities only screened when the child is 7 years and above. Below
Okay.
7 years, learning disability is not diagnosed. 7 years and above, like in second standard or third standard, when the child starts showing lot of spelling mistakes, the handwriting is poor, the spacing is very poor. The child is not able to write a small essay in a proper format. They go slant, they go upwards. So these are some of the traits which are seen. Plus, one of the major factors which we see from diagnostic point that the child needs to have an IQ of 90 and above.
Okay.
Only like when the child falls in average IQ, only then they can have learning disability. Whereas if the child is showing all these things, but their IQ is between 70 to 85 or between 70 to 80, then they come under borderline intellectual functioning, which means slow learners.
Understood.
So
Okay.
they have similar traits, like slow learners and LD children have similar traits, but a formal IQ assessment has to be done.
Okay, but one doubt just cropped up. Okay.
Hmm.
Supposing the IQ is very good, but it's just showing still all the symptoms. So
Then
that
they have
means
learning disability.
then
Then
also
they
they
have
have
learning
learning disability above 90, everything. If the
disability.
IQ is above 90, whichever figure it is, but
Correct.
still these problems are there. That means the child has learning disability.
Has learning disability. So main factor of learning disability is not related to intellectual quotient as such or intellectual functioning. It is purely academic related, and it doesn't like people who have LD. They don't face any issues later on in their life when it comes to
Understood.
job because if a child has writing, like if a child has writing issue, so writing is an issue. But if it is replaced with technology, like if they are given keyboards or if they are given any kind of age like the computer age, then they don't face anything because autocorrect option is something which they can opt for. Grammatical
Understood.
errors don't come into picture. Reading, for that matter, they can reread it 2, 3 times. So, as such, LD doesn't hamper later in life, but during academics, if the child is facing issue, so there are a lot of concessions given by the school, like extra time, just understanding the conceptual knowledge rather than focusing on the spellings and what the child has written. Child can be given concession related to writing essays. So for that matter, like essay answers can be replaced with pointers. So
Understood.
child doesn't necessarily need to write essay; they can just write pointers. Some kids who have like great difficulty with writing or severe dysgraphia, so they can actually opt for a reader right. So there are a lot of concessions given by the government for that. There are certain processes the parents have to do.
So, if supposing a child has learning disability, will it be correct to say that parents really need not push the child too hard, rather take the concession would be a better option?
Yes, definitely. Because it is not the child's problem as such. That is how they are wired. So there is, and sometimes like the causes are still not known as per research, but there are many times which is reflected that if a parent has, or if any genetic composition is there in the family history that one person has learning disability, sometimes it's quite likely that the kids also tend to have the same learning disability.
So the primary concern should be to keep the emotional balance correct, right? Rather than not labeling the child or
Not really.
not
Yes, yes,
pushing it too hard,
correct.
knowing the fact that okay, this is an issue which the child is going to face during its academic years,
Exactly.
and
It's not
later
going to
on,
hamper later.
yeah, later on the child can it will not hamper any of its progress at a later point of time.
Correct, correct.
Okay, so
Plus,
because lots of parents do push their child because they're worried. Okay, 10th standard board exam, they have to get the practice. So, somehow push, pull, and, teach them, focus only on the exam writing because, yeah, because it's a competitive world now. So they have to. So do they
so they
get the
can,
concessions even for board exams?
yes, yes. So there is this like unique disability ID which is being promoted by the central government. So it is a disability card, like the way you get a PAN card, the same way it is a disability card. And after 18 years, it becomes a permanent card. So for specifically for LD, there is 1% concession in the job sector also, if
Understood.
you have this card. But only thing is the assessment has to be done to a government hospital only. Private assessments won't consider. Whereas just during the academic years, just to understand why my child is having a issue with reading or writing, they can go and consult a professional, take their opinion, and then proceed further.
Okay. And but with are corrective measures helpful? Like, if they go for special
Corrective measures,
coaching.
yes. So in a way, like specifically for learning disability, they can offer remedial education. So rather than reading the material from textbook and then learning it, a special educator or a remedial educator can help them understand the concept behind it. So that is one of the areas which can be worked on, like seeking help of a remedial educator or starting remedial education. And apart from that, if the child is just given some kind of practice at home, like for example, the child has minimal handwriting issues, so or with speed, they have issues with speed, so they can go for daily copywriting techniques or reading a newspaper,
Hmm.
but not forcing the child if the child is not able to do. Just seeking help of some external, like asking for a reader, right, for that matter.
Hmm. So the point
Concessions.
to remember is IQ is intact. Learning disability is only with relation to reading, writing, or understanding the concept in the textbook manner, basically,
Textbook
while
manner,
academic.
yes.
In that format, if the child is having some difficulty to understand and express. So, but
Yes.
the child can definitely they understand the concept as such.
Hmm.
Correct. So,
Yes.
will they have any problem with their memory? Will they have short, like
No,
shorts? No, they can
no,
memorize
no.
things very well.
The point of learning, like having a average IQ, is that memory functions are intact, their reasoning capabilities is intact. Their only when it comes to reading a passage or writing something, that becomes an issue for them. Otherwise, their overall judgment, their abstract concept abilities, their conceptual knowledge about certain like specific abstract concepts like pity, jealousy, these kind of abstract concepts, they are very good in that.
Hmm.
So the child's IQ is not a problem. Their overall functioning is not a problem. Only when it comes to reading, writing, specifically related to academics, from the
Understood.
like during the schooling period.
Hmm.
In 10th also, like there are concessions given for 10th board, 12th board. Plus later on in life, there is 1% disability concession in the job sector. When there is a, for example, if the person has an LD and they are going for a job, they can actually ask for report work which is purely computer based and not
Not
handwriting
writing.
based.
Okay. So that is more to help them, not to label them. Like,
Not to
whatever
label.
their area of expertise, they would get a
I
preference.
cannot. Correct. Yes.
Okay. So because parents are really sometimes scared, or the labeling is something which every parent is scared of.
Mm-hmm.
Just second, huh? Just, yeah, this is actually a very, very valid point which you shared, because from my experience, I've seen that parents are more or less scared because they
Right.
don't know, okay, what next? Okay, if he
Mm.
can't do well in seventh standard, what will he do when he goes to 10th? What will happen
Mm.
when if he has to go to an international, go out and study? So
Right.
further education. So actually, accepting it would help them more,
More.
because whether
Yes.
they go to universities everywhere, they would get that chance to
Interesting. Yes.
express it in the way they know, rather than just getting stuck to reading and writing.
Mhm.
Correct. So even for university admissions, they won't have a problem, right?
No, no, nothing.
So learning disability will not take away the child's career away from,
Or no, definitely not.
that is a huge relief, because that is a main concern for parents. What would happen when the child is 18, 19, university admissions, international university agar jana hai, to kya karenge? So they really push the child, or keep doing, changing the schools. Every
Mm-hmm.
year, new school, in the hope that, okay, some magic would happen in the next school.
Mm-hmm.
Okay, the child would start writing or reading. So thanks a lot, because one of so many, there are more queries, but I just took the first, the most frequently asked questions. And as for the remedial teaching, because inclusive approach is there. So how should,
Correct.
one more last question before we wind up.
Mhm.
How should parents teach, give that training to their child, to their children, in their class there could be kids with different, different needs. There could be a child with a learning
Mhm.
disability, or a neurodivergent child, because inclusive
Mhm.
schools are happening. So even
Correct.
parents should know, like, okay, if the child comes home and tells about that child, okay, isne aisa kiya, he didn't
Mhm.
know, only he got 0 on 10 because all the spellings were wrong, or some kind of, when they come home and talk about it, what should the parent tell? How should the parent prepare their child?
So I would suggest that rather than thinking that my child has an issue or someone has an issue, they can just use a multimodal approach of learning. Instead of if the child is not able to sit and read, or if the child is not able to write things, they can use visual aids. They can use auditory learning, more of a teaching method than using just textbook and
Hmm?
paper. So also understanding that again, how is it affecting the child's overall emotional development? Like whether the child is feeling less confident, whether the child is feeling left out from the group. So these are some of the concern areas which the parents can actually ask the teachers whether the child is facing these kind of issues because of his like abilities which are getting hampered. So having a holistic understanding where how it is affecting them psychologically also. So that is something which they can focus on more than the academic part that my child is not able to read or write.
Yeah.
How is it affecting them emotionally, psychologically, their overall confidence level, their overall awareness about themselves, their socializing abilities. So these are also some of the areas which are important and not just the academic which is important.
And
So just
about the help from other parents, against the, it's a mixed bag in the classroom, right?
Mhm.
So the normal, I won't say normal, regular parents jo hai, regular bacche ke parents hai, how do they educate their children? In your class, there is going to be
Mhm.
someone like this. When they come home and talk about it, how do they explain that to their child?
So the parents can actually tell the child that there are some disorders which are only, relating to studies, or there is some condition. So just making the child aware without having any hesitation as to how should I discuss this with the kid. Because the child needs to know the facts, and if the facts is given by the parents, they can trust them and accept them much more better way than just knowing about it and then labeling or bullying the kid ki isko ye nahi aata hai, wo nahi aata in
So
that one.
basically telling the child that, there are different ways, every child has a different way of learning. Simple, to put it in
Correct.
simple manner. Every
Yes.
child learns in a different way.
Hmm.
So, in a class, you all are equal.
Yes.
Everybody is same. In a class, everybody
Correct.
is same, right?
Hmm.
Okay. So before I end the session, what is your message to parents?
Okay. So my message to all the parents is do not compare your children. Every kid has a different layer of development. Plus, there are different means which are available right now. There is a lot of development where you can keep the child engaged with a lot of other activities than giving them screen time and just giving them something so that they can shut up. So there are a lot of engagement activities which are actually there. Also, I would say that instead of going into the parent mode, if the parents start going into more of an observer mode, where they're just observing the child, their development, their progress, they would be much more detached and then they can identify the issue much more quickly rather than being a parent and that emotional quotient and projecting their own fears onto the child. So just being in an observer mode and just observing the child's overall development, how they are exploring, how the child is curious. Because many parents till now I have seen that they just project their insecurities or their development. Like they keep on relating it. I was doing it in my childhood. He is doing the same thing. Hence, I'm worried. Whereas the child is just in an exploring stage, not actually showing all these behaviors that you are worried about. Plus, the way of communication. Like if you talk to the child in a childlike manner, they will understand you much more quickly than giving them instructions, constant instructions as to what has to be done, what has to be not done. So instead of less instruction, more observation, and just being with the child the way they are. So if they
Perfect.
have,
Less
yeah,
instructions, more observation is the takeaway message.
yeah,
Yeah. Thanks a lot. I'm sure this stays with the parents. And yeah, when more queries come in, we'll meet again for another
sure.
episode of Pearls of Wisdom. Thanks a lot. Yeah.
Thank you. Thank you
Okay.
so much. Bye.
Bye.